What up, what up, what up? It's the PAC, man. All things physician associate. And in this video, I want to talk to you guys about not falling for the trap of the high paid PA job, man. And I'll jump right into it with the, I'll give you like an example of a notoriously enticing job offer that you'll get, particularly in surgery. They'll come at you with, these numbers are specific to South Florida, but they'll come at you with like, hey man, we're gonna start you at a salary of $120,000 fresh out of school. What's up? And you're like, what? Yes. And then when you start working, you realize that surgery takes a lot of call. So you have your scheduled surgical days. Let's say the day in the life of a surgical PA. You have the day in the life is you're gonna have your surgery days, where surgery starts at 7 in the morning. Let's say you end at, let's say it's a very aggressive young surgeon and he works till 5 p.m. So you're 7 to 5. You're assisting in surgeries, and then let's say 5 to 7. Finishing up some notes and rounding on some patients. Rounding means patients who've had surgery that week and were admitted to the hospital for pre or post-op observation. Someone needs to go in and check on them daily to make sure they're recovering well from surgery, and that someone is you, the PA, most likely. So let's say whatever, you're out of there. Let's say you do 12-hour days, man. And let's say the surgeon again is aggressive, so he works 4 surgical days. And then one day is a clinic day. So that's the day where he or she receives new patients, right? So these are the patients that will be scheduled in the future days and weeks to come. And that's how they keep their schedule locked up, busy. And so then what happens on the weekend? Well, if you did surgery on Friday and the patient was admitted, let's say they're going to get discharged Monday, well, somebody has to, again, see them daily. So who's going to check them out on the weekend? Again, that's you. And then, so 12-hour days for 4 days, you've already passed 40-hour work week. And now you're coming in on the 5th day to do clinic day. So it's not hard to see patients in the office in comparison to a long day of surgery. So it feels like it's not really a tough, long day. And then you're coming in on weekends. And then there's what we call bringbacks, where the patient has post-operative surgical complications and we have to bring them back into the operating room. Depending on which specialty you're in, that's very common, especially in cardiothoracic surgery. If there's a bleed, let's say if you develop a little bit of let's say you did a knee surgery and you get a hematoma in your knee, we just stick a needle in the knee and drain the blood out. But if you're bleeding in your thoracic cavity after heart surgery, we got to go back in there and stop the bleed. So back to the operating room. This could happen, for some reason it happens in the middle of the night. You get that call saying, hey, this patient blood pressure's dropping and whatever, send them for CT scan, and there's a bleed in the chest, and back to, even if you're not going to do the surgery, the PA is going to go right back to the hospital to continuously manage this patient until they're stable. So all of a sudden it turned into a 60, 70-hour work week. And I start thinking, well, wait a minute, $120,000 a year divided by, best case scenario, 60-hour work week. Okay, so I don't know, somewhere under $3,000 a week, assuming you have 2 weeks of vacation in my mind. These are rough numbers. So let's say $25,000 to $3,000 a week divided by 60-hour work weeks sounds like about $40 an hour. $40 an hour. Anywhere you work as a PA, the standard pay is $50 an hour. This is, again, specific to Florida. And that's for like no experience. Like, oh man, you don't know anything, so we're just gonna pay $50 an hour. An experienced PA makes more than that. So it's like, all of a sudden that 120 sounds like not a good deal at all when you start to really break it down in such way where you're like, man, this is just not what I signed up for. Now here's the problem. When you're in that field and you're working like that, you don't realize that you're being overworked because everyone around you is doing the exact same thing, right? So let's say you work with Dr. ABC, and Dr. ABC's partner is Dr. XYZ, and he or she also has a PA. And guess what? At 2 o'clock in the morning, you see Dr. XYZ's PA in the hallway, and you're like, hey, Christine, how you doing? And it's, you get numb to the fact that you're being overworked because everyone else is being overworked, and it kind of just dissolves into your brain, and you don't really step back from your situation, partly because you're just exhausted all the time, to realize that, wait a minute, none of my friends outside of the surgical setting is being overworked like this. People working Monday through Friday, 9 to 5, making more than me. Off weekends, making more than me. Home before sundown, making more than me. Work half day. I'll give you some examples. One PA, $120,000 a year she makes. Monday through Thursday, 9 to 5, and then out by noon on Fridays. No weekends. 120 salary, whether you show up or not, that's what you're gonna get. I'm like, wait a minute, when you factor that, that's about 60, I would guess like $65 an hour if you wanted to break it down to hourly. And that's a chill schedule, you know, and that's like 3 minutes from her house. Like, that's a chill schedule. No one's calling her. She does take call, but it's partly due to, like, you know, a patient has a question about their medication or something, but not like having to leave her house. But, you know, life is about goals, man. So it really just all depends on what you're most interested in. Anyways, I just wanted to bring up that point, man. I hope this reaches everyone, and or reaches who it needs to reach, man. Much love. See you guys.